The providers at Oncology Specialists of Texas are committed to providing high-quality, patient-centered care. We offer genetic counseling services to our patients as well as genetic testing. Genetic counseling is the process of advising individuals and families affected by or at risk of genetic disorders to help them understand and adapt to the medical, psychological, and familial implications of genetic contributions to disease. Genetic testing is the process of collecting, examining, and evaluating blood or saliva samples by a reputable genetics laboratory for genetic mutations, which may result in an increased risk of developing certain cancers. You may be appropriate for genetic testing based upon your own personal and/or family history of cancer. The criteria for genetic testing is established by medical society guidelines, and we highly recommend genetic testing for those who meet qualifying criteria. The Hereditary Cancer Panel analyzes genes to identify genetic mutations that may cause an increased risk for 8 primary cancers, including breast, ovarian, endometrial, colorectal, gastric, pancreatic, prostate, and melanomas. Genetic testing clarifies your specific cancer risk, the screening, management, and treatment options that are most appropriate for you based upon your genetic makeup. The results can determine why you may have developed cancer and/or your risk of developing a second cancer in the future. Due to the implications for your children and other family members, if your results are positive, meaning that there is a genetic mutation identified, placing you at higher risk for developing cancer, it is very important for you to share your results with your family. If positive, children, siblings, and parents each have a chance of having the same genetic mutation. Treatment may change based upon your results, which could include increased surveillance, chemo prevention, prophylactic surgery, or modifications to family planning or lifestyles. A specifically tailored cancer prevention plan and the implications of your genetic test results will be reviewed with you at your results appointment, which occurs approximately 3 to 4 weeks after testing. Patients considering genetic testing are often concerned about the privacy of their results. It is important to note that there are federal laws such as GINA and HIPAA that provide protections against discrimination. The lab will not release the results to anyone other than the provider ordering the testing unless you provide permission. Patients considering genetic testing are also often concerned about cost. Over 95% of insurance plans will cover the cost of genetic testing for appropriate patients. The average out-of-pocket cost is less than $100. If you have any questions or concerns regarding genetic testing or genetic counseling, please feel free to speak with one of our providers, and we will be more than happy to address your concerns and answer your questions. Thank you again for choosing Oncology Specialists of Texas. We look forward to accompanying you throughout your healthcare journey.